I Nice to meet you in person too. Thank you.
How can AI influence advanced the field of monitoring in recent years?
AI technology. Yes, yes. So one of the obvious things in ophthalmology is recognizing patterns, patterns of changes in the eye. So in the field of diabetes, we've been able to use photographs of the retina to recognize patterns of changes, like little splotches of blood that might appear, that are then sent to, a computer picks them up and is able to say that, okay, this is concerning, and send it to a physician or an optometrist to look at. There have also been softwares developed to look at changes in the optic nerve. So pictures of someone's optic nerve are taken every so often, and then if there's any subtle changes of thinning in the optic nerve, that is a sign of, that could be a sign of glaucoma. Because in glaucoma, what happens is it's a disease of the optic nerve. It's an optic neuropathy, and basically you have certain patterns of thinning in the nerve that occur in anyone that has glaucoma. So if they don't have access to a physician or an optometrist that's able to follow them, then they get like pictures taken when they say visit their regular doctor, and those can be sent to the AI software can pick up and see if there's thinning in that pattern, if there's any changes at all, and help the patients that way. And there are many other uses of artificial intelligence.
Have you had the opportunity to any of the advancements?
So I have basically, the technologies that we're using now are pretty advanced. We have this machine called the OCT machine, and the OCT machine, it takes pictures of the optic nerve and the retina, and it gives us a picture of the slices of the retina and the retinal nerve fiber layer, which is one of the layers of the retina that we see the thinning happens in someone that has glaucoma. That nerve fiber layer gets thin, mostly superiorly and inferiorly. And so the OCT machine measures the thickness, and then when the patient comes every few months, you get another OCT. If someone's glaucoma is not controlled, then the nerve keeps getting thin in that manner. And these machines are so accurate, for the most part, in measuring that thickness, that we're able to use them to pick up these subtle changes that sometimes are not obvious when you examine the nerve at the slit lamp with the naked eye, like when you're looking at the nerve. So yeah, I mean, I think that is a use of technology there. As far as how much of it is artificial intelligence, personally, I have not used much, but technology, I would say yes. We use it all the time
Yeah.
to take care of it. Yeah.
Oh, how do you handle the yes, the immediate fall of the aging year?
Yes, great question. That's an excellent question. Yes, difficult cases. How do we handle those where the immediate course of treatment isn't clear? So, consultation comes into this a lot of times. If there is a case where I'm not 100% sure on what's the best course of treatment, then I'm always open to, going and talking to one of my colleagues and discussing it with them, or um, even sending the patient for a second opinion to one of my colleagues and saying, what do you think about this diagnosis here? Um, you know, do you think this? Am I missing something? Or in the evening, I might even call a colleague, a mentor, and just run something by them. Yes, it does happen.
Mm,
It does happen. And I think, again, like consultation, um, always being open to different diagnoses. I think sometimes the error of like just thinking it's one thing and not being open to consider
mm,
other diagnoses that could be causing this presentation is important. Um, yeah, but yeah, I do sometimes get those cases. Yes.
yes.
Great question.
To be open, yeah, the main important in everything is important.
Yes, yes, that is it is always very important to be positive. Yes, and hopeful. Yes, from the physician's side and also from the patients themselves. Um, I think that um, I'm often surprised by how resilient the eyes are. You have someone that has eye trauma and they have unfortunately a ruptured globe of the eye, so the eyeball has ruptured in an accident or something like that has happened, and we take the patient to surgery and we repair the laceration or the cut on the eyeball and put it together. And you think that that eye won't have much vision as the surgeon when you're operating. You think, oh, maybe this eye, probably won't see well. And then you're pleasantly surprised weeks later when that eye actually sees much better than you thought.
So,
So, you know, I think being hopeful, always doing your
uh,
best from the patients and the doctors is very important because you never know. And there's so much I feel like we still have to learn about when it comes to ophthalmology and the visual pathways and vision itself. How we see something. Um, so it is humbling, um, but yes, being positive, being hopeful is is very important. I would say. I think it's very important. Yes.
yeah, go to it, how, how polemic can impact our
Scientifically, um, I think that like believing that you're doing something that's going to help you um, has an effect, has a pretty positive effect. So I think that objectively, like the placebo effect is, it's been shown that it can work a third of the times just by the fact that the patient believes that something's going to help them, uh, even if they're not taking the medicine, but they're doing something that they've been asked to do, that can have an effect. I mean, it's been shown. Um, um, but I think that being hopeful, being positive, in general, I think it helps us. We when we're happy, for instance, and hopeful and joyful, we understand things better. Um, you know, we are our understanding is more sharp. We're able to do things, accomplish things in a better manner. So if it's a patient that's going to heal, they heal. I think they would heal better if they're hopeful, if they have positivity. So yeah, but beyond that, personally, I haven't studied it scientifically to be able to offer insights into that.
Well, what what are some of the more community in the UK in evidence and what policy to improve for them?
What yes. So in emergency cases, so as an eye doctor, when I see an eye emergency, I'm trying to figure out what caused this emergency. Um, Personally, right now, I see patients with uh, like high eye pressures that will come in. They may have acute angle closure, and it could be from a number of reasons. It could be um, because of uh, having uncontrolled diabetes where new blood vessels have formed on the iris of the eye and have invaded the angle of the eye and clogged the drain of the eye, causing the pressure to rise up and the patient to be in a lot of pain and having nausea, and obviously decreased vision. So the goal is to figure out what's going on because the therapies are dependent on what's causing it. So in some patients, it might be that the lens in their eye has grown so big that it has caused the angle to close, that has pushed the iris up against the drain of the eye. And now the fluid can't drain from the eye and the pressure is high. So in those cases, a lot of times if you exchange the lens by doing cataract surgery and putting a new lens in the eye, it deepens the angle and oftentimes it will resolve the high eye pressures unless uh, the drain is now scarred, um, and then you may need eye drops or glaucoma surgery. Um, if a patient comes in to me on call and they are um, a contact lens wearer that now has an ulcer on the eye that's painful, that their eye cannot see much, their eye is red, tearing, they're very uncomfortable. I worry that that ulcer could cause the loss of the eye because those bacteria are chewing through the cornea and they can cause a hole in the eye for us to lose that eye. So you know, in patients that wear contact lenses, it's very important to maintain good contact lens hygiene, to not sleep in your contacts, make sure the solutions you're using are clean. So it depends, you know, when I see somebody, try to figure out what is the issue and what are the things that can cause vision loss and how to prevent them. Sometimes I see a patient when I'm on call that comes in and their retina has detached, unfortunately. So in those cases, I want to do a full eye exam, see if I can find where the tear is, so I can then tell my retina colleagues about the patient and have them sent to my retina colleague for repair. Um, yeah, the challenge, I think for me is always like, you know, getting to the diagnosis, getting to the point of um, what has caused this emergency. Some patients that are older can get a condition called giant cell arteritis, where it's an inflammatory condition where it affects the blood vessel that supplies blood to the nerve of the eye, and it can present with you know, pain on the temple area, the scalp. You know, you can have pain in the jaw when someone is chewing food, um, and so then it affects, you know, one eye, and you want to pick this diagnosis up because you can treat it with steroid medicines, which are anti-inflammatory medicines, so that you prevent this from happening in the other eye. Now, if you don't treat it, the patient could get systemic problems like a heart attack, like a stroke in the brain, and in many cases, the same process that made them lose vision in one eye can then go to the other eye. So getting a good like history, figuring out, you know, when something started, how bad is it, what makes it better, what makes it worse. Just gaining as much information as you can is very important, and that's where like family comes in. So if someone has an eye problem, it's very helpful, you know, because the patient's in a lot of pain, they may not be able to share so much with you at that in that instance. If the family members are there, they can tell the doctor, you know, this happened. These are the medical conditions that the patient has. These are the medicines they take, and you know, this vision loss happens suddenly or it happens gradually, whatever the case is. I think it's very helpful because I find sometimes the patients are unable to share a lot about what's going on, and maybe they think I already know everything. I always tell them only God knows everything. I have to ask you questions. So yeah, I think it's important to be able to get a good history and then do a very thorough exam to find out what's going on.
Yeah, well, you know, on the I am absolutely.
Oh, the app share. Oh yeah, it's been excellent. Yeah, I've enjoyed talking to you through it. Yes, thank you. Yeah, it's been really good. I wanted to share one one quotation from the writings of Baha'u'llah, who's the founder of the Baha'i faith, and you know, we have the beautiful Baha'i also worship in New Delhi, which I had the pleasure of visiting multiple times. So I wanted to share something he said that has struck me. He said, "O man of two visions, close one eye and open the other. Close one to the world and all that is therein, and open the other to the hallowed beauty of the beloved. Yeah, I think that in the physical world, we find many examples of things, and in the spiritual world, there are counterparts. And I think in this quote, when he says that we have two visions. You know, we have the physical vision from our eyes, but then we also have the spiritual vision. So I think I love that he has given that example, that we close the eye to the material things of the world, but we have to open our other eye to the spiritual things in the world, in that we see in the world. You know, it is so important. So, yeah. Oh, yes. Thank you so much for having me on your wonderful interview on your program. I think that the one thing I would say is, if you do have ever any change to your vision, or if you notice anything different, do not ignore it. Have it looked at. You know, go get seen, because I often find if you pick up something early, if a patient has a problem, you can oftentimes help them earlier in the process, and the outcomes tend to be better. But if, like, the patient waits a long time, then something can progress, and the outcomes may not be as good. So if you ever notice that that you have a problem, go get seen. You know, it is important to take care of your eyes and your health in general.
Thank you so much, Dr. Mithaq, for this interview.
You're most welcome. You're most welcome. Thank you for having me also. And Anand, it's so nice to see you. I have to make a trip and visit you in person. You and Ahmed, the family. Thank you. Thank you so much, my brother. Thank you.
Goodbye for now.
Bye. Bye. Thank you. Nice to meet you in person too. Thank you. Thank you, Anand. The interview experience was fantastic. Thank you. Thank you for having me. I thought your questions were very thoughtful and profound, and you really wanted to get to the heart of the matter, and I really enjoyed talking to you. And it's very nice to see you in person. It brings back a lot of memories from childhood. And your brother, Ahmed, of course.